What a profound study. This done in individuals with diabetic kidney disease over a 24-week period of time. What we're looking at right here is the comparison of Shenzhuo versus Irbesartan. Irbesartan being the most common pharmaceutical, Shenzhuo being an 1800-year-old, at least traditional Chinese medicine, most commonly used in cases of blood stagnation. Now, Shenzhuo is amazing. Look at this. So, Irbesartan, yes, it does, and it has helped a lot of individuals, and it slowed the declination of kidney function. But you see what Shenzhou did as far as filtering speed and improving the overall health of the kidneys themselves? It actually reversed that trend. So we got a lot of territory to cover, so let's get right into it as follows in a limited amount of time. So let's go to number 2 here, our slide. There's your 5.91% boost in regard of glomerular filtration rate towards the bottom, as well as the serum creatinine, not creatine, creatinine drop. Again, I would love to see this go further than 24 weeks because I want to see exactly how far this damage can actually be healed. That's the way to put it. All right, so the randomized controlled trial of Shenzhuo Formula in the treatment of macroalbuminuria in diabetic kidney disease and its inflammation modulating mechanisms. Again, randomized controlled trial. And so it is quite profound. And you can read through the rest if you'd like to for context, but still let's move forward due to limited time. All right, the filtration recovery. You see the diabetic clogs as far as how it works and its comparison against the standard methodology, or I should say standard treatment of Irbesartan, and compared to SZF, which is Shenzhuo Formula. And it was taken twice daily in packets for about a 24-week period of time. And it actually helped the kidneys work better, and far better than the standard treatment group overall. And here we go as far as I say the victory lap. It's a victory for the individuals with this challenge, not as far as comparison of one treatment over the other. But Shenzhou is quite amazing overall. Again, work with the healthcare professional. It actually, we're talking about active organ recovery. And that yields incredible, I don't want to say hope. That's like hoping someone comes up with something. This is something that shows promise. Again, reiteration, future studies need to validate over and over again, but this was a good study overall. And so as we look further into it, as you see right there, 120 patients, 11 hospitals, 24 weeks, placebo overlap, again, double-blinded, as well as a randomized controlled trial, which you have to be. There's your dosage of the Irbesartan versus the 2 sachets of the 75 grams of the Shenzhou formula. All right, and here is the breakdown of that formula. You see, now I'll show you the common names in a second, but that's how it's processed. Widely used the granules as well, and you had an 89.5% symptom recovery rate. That is really, really incredible. Hopefully this video gets some traction because this is good news for a lot of individuals that become aware of it overall. And so here we look at it right here. Let's get right into the study as follows. It's kind of funny. As you read through the study, nowhere through the public article, it just says traditional Chinese formula. It doesn't mention the name of the formula, except for one thing under a picture which says SZF, but it's Shenzhou. So to proceed as follows. A new randomized clinical study evaluated whether a traditional multi-herb formulation, Shenzhou, could offer comparable or superior benefits to standard therapy. The research found that while both treatments similarly reduced urinary protein levels, the herbal formula significantly improved key indicators of kidney function, including estimated glomerular filtration and serum creatinine. That's to reiterate the data we looked at earlier. To move a little deeper into the study as follows, there's your common names. Again, pretty common, and yes, you're right at the end. It says 6 herbs, but leech, is that an herb? No, I don't think so. But you got to keep in mind, well, why leech? Well, leech has powerful blood thinners in there. In this case, it helps with the stagnation. Again, they're not adding publisher bias. That's part of the formula. There it is. Gives you good context. All right. Also, too, as we proceed forward, for those statistical analysis and data analysis, always throw that in there for the quality of the study. It's important. People's lives may depend on the information that's released from a study. So it's important to study the study. Just don't take the study's word for it. Look at the study. That's why you have retractions. All right, here we go. As follows, the ancient wisdom. I put up there, you can read through, again, limited time, but you want to read why the leech there. I think leech contains hirudin and something like that, as far as a very powerful blood thinner as well, and the history of the roots itself, which is quite intriguing. Incredible detailed information. Historically, great history. I want to know more. All right, the rigor in the study delineation looked good. That's the strength of the studies, the animal study analysis, the limitations, yeah, the severity and so on and so forth, but you need to know that so you can address this in future studies. A lot of the public may go, that looks cool, but it was a well-conducted study with some really good strengths. All right, now I'll go into the conclusion of this research as follows. The most striking aspect of this study is the improvement in kidney function, not just stabilization, said one of the corresponding investigators. Many existing therapies slow decline, but few demonstrate an actual increase in filtration capacity. By integrating clinical trials, molecular and single-cell analysis, we're able to link these functional benefits to specific inflammatory pathways. The animal analysis outside of the human study. First, they saw it worked in humans, then they went to the animal analysis to try to find out why. This systems level approach strengthens confidence that the observed effects are biologically meaningful and not a simple statistical variation. There's your Bayesian analysis and a few other things I do in there on top of that. And the layman's synopsis, why this matters. For years, doctors have used drugs to stop the kidney from leaking protein, but the kidney slowly died. This study shows that the Shenzhuo Formula acts like a cellular fire extinguisher. It does not just stop the leaks, it turns off the internal alarms that cause the permanent scarring. This means, not your kidneys, but per se, again, has to be validated in future studies as well, so this is not the end-all and be-all. This means your kidneys could actually stay healthy longer, potentially avoiding dialysis for many more years. Once again, only 24-week study. Let's see how it goes, 48 weeks, 96 weeks, so on and so forth, but still just the same. An incredible tool has now actually it hasn't become. The incredible tool has been around for thousands of years, at least 1,800 years, but an incredible tool is there. It's just a matter of figuring out how it can be used to best help the individuals with this diabetic kidney disease challenge, but it does give a tremendous amount of promise. I don't want to say hope, because hope means you hope it works. The study is valid. It's showing it works. The question is now how to make best use of that tool and other indications, side effects, so on and so forth, and who it's for, who it can't be for, so on and so forth. But still such the same, Shenzhou, phenomenal. Gratitude to the researchers. I'm grateful they brought this to our attention. Of course, thousands of years of traditional Chinese medicine as well. Still just the same. They did the study. I am humbled you watch and see what both you and I discover next week. Catch you all next time. See you then. Bye.